Good afternoon from EULAR 2026 in London. My name is Elise van Mulligen. I'm a researcher and epidemiologist from the Netherlands. And today I'm joined by Dr. Andrea Di Matteo. He's from Leeds, from the UK, and we're going to talk about your presentation today. Welcome. I'm very happy that you're able to join us today. I had some questions about your presentation. First of all, you showed that tenosynovitis is a very good predictor in patients at risk for RA, especially the ACPA-positive at-risk population. Can you maybe share a little bit of thoughts about why this feature?
Thank you very much, Elise, and thanks for the kind invitation. Yes, as you said, in our work, we show an important role of MRI and tenosynovitis in the prediction of future progression to inflammatory arthritis. This was already showed by previous cohorts, particularly in clinically suspect arthralgia, and it was confirmed in our study where we included patients with positive CCP antibodies, MSK symptoms, without clinical synovitis, so in a precise context. MRI and tenosynovitis appears to be a very important predictor in this population, suggesting maybe supporting the hypothesis that the first joint target in pre-RA is actually extra-articular. Previous studies have showed the involvement of the flexor tendons, but also the interosseous tendon. And I think our work is important because it provides some insights into the early pathogenesis on this condition, and obviously the importance of imaging for the early detection of individuals at risk of progressing to clinically evident disease.
Yeah, exactly. I agree. And talking about imaging, you researched two types of imaging, MRI and ultrasound. How do you see the clinical application of these two imaging modalities?
Oh, thank you. That's a very, very important question. Yes, our was a dual imaging study. We evaluated the role of ultrasound and MRI in the prediction of inflammatory arthritis. And we actually found that there were two main features which were associated with progression. One was the MRI and tenosynovitis, and the other one was the presence of bone erosions on ultrasound. And actually, patients who had both features, so both MRI and tenosynovitis and ultrasound bone erosions, had the highest chance to progress to inflammatory arthritis. So, in other words, our work suggests a dual imaging approach in these patients. If you have the opportunity to do both imaging studies, that will help provide the highest chance to identify patients who are likely to progress. Obviously, the choice of the imaging tools can depend on your availability. The centers, as you know, that might prefer doing an MRI, whereas ultrasound could be considered like a pragmatic imaging tool. So I think it's important to say that both imaging tools have a complementary role in the prediction of inflammatory arthritis in this population.
I had another question, maybe more about the future. So tenosynovitis appears a really good predictor. Can we maybe use it in future trials to detect patients at higher risk, for instance, for maybe future treatment studies?
Absolutely. I think you are absolutely right. I think the detection of MRI, tenosynovitis, and tenosynovitis has an important role from a research perspective as well as a clinical practice point of view. I think for people who are involved in research, as it's been the case, the detection of MRI and tenosynovitis should actually flag those patients who are likely to progress, which could then potentially be enrolled in prevention trials. But I think also from a clinical perspective, our results provide important insights because we actually telling clinicians that if you have a patient with MSK symptoms, positive antibodies in whom there's no evidence of disease yet, if you do an imaging study, which could be MRI, and this detects some inflammation in specific areas like the flexor tendon, that's a patient that is likely to progress, which might need obviously a different follow-up, closer monitoring, potentially treatment. So I think that's why it's important to identify this patient early from a clinical perspective as well as from a research point of view, as you said.
Thank you very much for sharing your thoughts and really nice discussion. And I want to thank you as well for watching. And I wish you a very nice rest of the Congress.